Hello, today I wanted to talk to you all about PCOS. So there's many clients that come to see me, and I've come across a lot of people recently who are going through Pcos and want to, if you don't know what Pcos stands for, it's polycystic ovarian syndrome. So a lot of people going through PCOS are having anovulatory cycles or really irregular cycles because of the high levels of the hormones androgens in the body. It can also be as a result of sort of multiple cysts, a lot of small cysts on the ovaries, or just elevated testosterone levels and other hormonal levels. So this can make the periods extremely irregular. A lot of people don't even know, a lot of women don't even know if they're even ovulating. So you could start by tracking your ovulation cycle. However, if it's really, really irregular, you have to look at sort of what you can do to sort of try to regulate that. Check your hormones if you haven't done a blood test to sort of get what the hormone levels are at, and even doing a scan to see whether, the cysts are quite a lot, if it's on both ovaries or perhaps only on one, or if it's just elevated levels. So that is a real struggle with women going through PCOS, is that the periods are all over the place. So they're not sure when they're ovulating. And if they're testing with the OPK tests, it's all over the place, right? They could be testing for, a week or two and you're still not possibly getting a peak. So if you're not getting a peak in your ovulation tracking, and even if you're doing temperature tracking, you might want to check with the doctors. And usually the first thing the doctors will put you on is something called letrozole or Clomid, which we spoke about last time, to sort of regulate the cycle. So if you're looking at more alternative therapies, right, I help patients through that using things like acupuncture, Chinese herbal medicine, supplements, but it mainly comes down to really looking at resetting and rebalancing your hormones through diet and nutrition. So it's really important that if you've got really irregular cycles, to really start looking at how we can regulate that. And the easiest way is to start by regulating your cycle through the right nutrition, supplements, vitamins, right? And a big thing is generally people with PCOS are looking at sort of weight management as well. So maintaining your weight to being ideal is crucial for the management of PCOS, because that can really help to optimize your chances for conception. And if you're at a more regular, more sort of optimal weight, it's able to help you regulate your hormones and improve ovulation as well. So really looking at adopting a really healthy diet. If you're not sure, then really speaking to a professional, please reach out to myself, or if you've got someone you're working with, so that they can really help you to balance out the right individualized diet. And I see that even with PCOS, there are so many diagnosis, even in natural medicine, about the reason why someone is going through PCOS. So you may do a general diet, but we also need to really hone in on the specifics for you as an individual. And this is where this can go wrong if you're just seeking out sort of a general GP. They're not really looking at your specific individual diet. They don't even really go into diet. So it's really, really frustrating when women are getting really regular cycles. They're not even sure if they're ovulating, and they're finding it really hard to fall pregnant. They could be, still dealing with PCOS for a couple of years and still struggling to fall pregnant. So if this is you, please reach out. Got lots of great tips where I can help you and really look at you as an individual to help you balance out your hormones. Another quick tip is to make sure you are doing exercise. Really good physical exercise will help to improve your insulin. Also supplementation, if you haven't checked what your insulin is, to really have that looked at as well, because that's one of the first things, is to start regulating your insulin levels. And that will really help you also with engaging with the physical exercise and help you to drop the weight if weight is an issue. So sort of aiming for a good sort of 150 minutes a week. So you're looking at, 40 minutes a few times a week to really ramp up and get some of that physical activity going. And yeah, just be quite regulate and tracking your ovulation for now, and if that's an issue, get your hormones checked and really look at sort of what the issue is and how you can improve ovulation through natural means as well. And if that's not an issue, look, generally GPs will recommend some drugs, some medications such as letrozole, but there are some great natural methods as well that you can consider if that is a problem. And also looking at managing stress. We know that stress is such a big factor when it comes to hormones, and that's so when we are going through much stressful situations, we're going through stress, it's going to really impact our hormones and affect our ovulation. So there's just some of the tips I'd suggest. But yeah, PCOS is a real issue for many women at the moment. So if you're one of them going through PCOS and you'd love some more advice, please feel free to reach out, because what works for one person is not always going to work for a second person who are both going through PCOS. So that's when individualized medicine and customized sort of treatments is really important for each individual. So I hope that helps, and thanks for tuning in. Bye.